welcome to yet another episode of Guest Room. Today we have with us Dr. Jell Oberg, who have been specialized in neuroendocrine tumors. So let's welcome him to the program. Welcome, doctor. First of all, we'd like to know more about you.
I am specializing in neuroendocrine tumors since more than 30 years. I have been working in all phases of the development of new drugs, new diagnostic procedures, imaging, and whatever you can think about. And I have also been establishing international societies for neuroendocrine tumors, European Neuroendocrine Tumor Society, and I'm a member of APNETS and also member of North American Neuroendocrine Tumor Society.
Okay. So could you just explain to laymen what actually neuroendocrine tumors are?
Neuroendocrine tumors have been considered to be very rare tumors, and therefore the patient has been diagnosed rather late because these tumors have been mixed with other type of cancers. A neuroendocrine tumor is a very heterogeneous group of neoplasm. Some of them present distinct clinical symptoms such as flushing, diarrhea, and some of them have low blood glucose, some recurrent ulcer disease, some of them have also skin rash. And some of them are completely silent, and they are just detected by a routine CT scan. And therefore these tumors have been diagnosed rather late in the life, and some patients might have had the disease for more than 5-6 years until they get correct diagnosis. But it's usually a slow-growing tumor, and the patients are feeling fine. So when the relatives are asking them, they can't see that they have a cancer. So they are not losing weight, they have normal blood parameters and so on.
So what are the main challenges that the neuroendocrine cancer patients face?
That is the diagnosis. Usually they go to the GP and say that they have diarrhea. Some of them say that they are flushing. And if you are a female, you had flushing, then they say, okay, you are coming into menopause, but that is not true because they have a carcinoid tumor that is producing serotonin and tachykinins, the hormones that are causing this flushing reaction. Also, males are misunderstood, and they get also very peculiar diagnosis for 4 or 5 years until they get the correct diagnosis. Then the other thing for this group of patients is that they not always get correct treatment. They are treated in a very bad manner concerning actual anti-tumor treatment and also for the symptoms.
Okay. So what are the symptoms of this?
The symptoms from, as I pointed out, can be manifold. Some of the patient has flushing diarrhea, some have recurrent ulcer disease, some of them had skin rash, some have low blood glucose, and they are suffering from this hormone production that causes them a bad quality of life. You can imagine a patient that have 10 to 15 diarrheas a day. When she is going out for shopping or something, she must always know where the toilets are located because she needs to go so often to the bathroom. So they face a lot of problems in the daily life, which reduce the quality of life.
Okay, so how can we diagnose it?
Today we have a lot of methods that can give an earlier diagnosis and a better quality of life for the patients. We have so-called biomarkers that are hormones that are produced by the tumor, and one general tumor marker is chromogranin A, which is a very robust method that you can analyze for these patients. Of course, you take also specific hormones related to the clinical symptoms. So if a patient presents flushing or diarrhea, we take serotonin, urinary 5-HIA, and other hormones, VIP also. We have also new imaging techniques. We are using, of course, the standard CT scans, MRI, they have been improved over the last years. We have specific molecular imaging using radioisotopes, and the most sensitive just now, which is spreading worldwide, is the gallium-68 DOTA-TOC positron emission tomography, and that can detect small tumors down to 3-4 millimeter.
Okay. So what are the treatments that you usually give to the patients?
Usually it depends on the tumor biology, because as soon as we have diagnosed a tumor in the patient, we take a biopsy. We want to have a tissue specimens that will be investigated. And based on the proliferation, the growth rate of the tumor cells, we decide what kind of treatment. If the tumor is a slow-growing one, we say that the proliferation is less than 2% dividing cells in the specimens. Then they get somatostatin analogs, octreotide, lanreotide. If they have higher proliferation, then we can consider for special types of tumors cytotoxic treatment. We have been using for many years streptozotocin plus 5-FU, and we have nowadays been using more and more temozolomide in combination with capecitabine. And we have also now radioactive treatment, PRRT, peptide receptor radiotherapy with lutetium or yttrium-90 DOTA-TATE, DOTA-TOC. And we have also local therapies. We can, if the tumor is only located in the liver, we can directly treat the tumor in the liver.
Okay. What is the advice that you usually give to the patients?
I think if the patient has feeling some symptoms that is very difficult for the doctor to explain, I think she should start to ask for a biomarker, a special biomarker for neuroendocrine tumor that is called chromogranin A. This marker can be elevated several years before she got correct diagnosis. And if that biomarker is elevated, I think she should go to a specialist and ask the doctor to send her to a specialist for further evaluation.
So lastly, what is a message that you would like to give to the audience?
My message is that today this disease, which has been considered to be rare, is not as rare as we have believed. So therefore, I think in doctors' mind, they should have a neuroendocrine tumor when they don't know exactly what kind of cancer or malignant tumor they have in front of them. And therefore, I think most patients should try to get to a specialist.
Okay. So doctor, that was nice talking to you. Thanks a lot for being a part of our program.
Thank you.
So that was Dr. Jell Oberg with us. Until we meet next time, this is me, Nana, signing off. Take care.